Welcome everyone to today's webinar. I am Brian Zimmerman, Senior Writer Reporter with Becker's Hospital Review. We will begin today's webinar with a presentation. We'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We're looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenters. Lesley Petrocelli is the Intern Perioperative Director at Baylor Scott and White Medical Center, White Rock. Lesley has 3 decades of perioperative nursing experience with manager and director roles in large academic medical centers. She has a master's degree in business administration, a bachelor's degree in nursing, and is working towards her doctorate in executive leadership. With a 30-year career in the U.S. Air Force Reserves as a flight nurse, Lesley served on many deployments and led aeromedical evacuation operations for the U.S. as the chief nurse of her squadron. Lesley is an active member of AORN and is a member of the Sigma Theta Tau National Nursing Honor Society. Mary Cross is a senior consultant, clinical operations for Cardinal Health. Mary has cultivated more than 19 years of experience working in operating rooms, with 15 of those years in OR management. Prior to her career at Cardinal Health, Mary held a variety of management positions responsible for staffing, patient flow, and scheduling within surgical services. Her rich clinical experience allows her to present at national AORN, local AORN chapters, numerous acute care facilities, and other professional organizations. For the past 20 years, she has consistently applied her clinical and technical knowledge to help healthcare providers with appropriate glove selection, double gloving, powder-free and latex-free initiatives that lead to hand and skin wellness for clinicians. She has been recognized by her peers and leadership for demonstrating core values, team leadership, and outstanding consulting throughout her career. Mary, I'll now turn the floor over to you.
Thank you, Brian. We know you have a lot on your plate, and if you're like most directors or managers, you're faced with balancing large pressing issues such as staff and patient safety, improving clinical outcomes, and increasing your efficiencies, all the while working diligently to retain your highly talented staff. Both Lesley and I know change can be difficult. It requires cost to evaluate new products or processes, time to train clinicians and staff, and the ability to overcome resistance, and of course that continuous effort to drive adoption. Given the constant demands and pressures to reduce costs, too often making a change isn't worth the battle. However, by leveraging industry-recommended best practices, you can successfully educate your team and lead the change to a safer department, a safer hospital. The 4 safety recommendations we will be discussing today can help you to achieve some of these goals in today's fast-paced, ever-changing healthcare space. Next slide. While many of these things are important, as healthcare leaders, you know that at the end of the day, nothing matters more than keeping your patients and your staff safe. When staff have a safe working environment, they're able to focus on the patient and provide excellent and efficient care. During our time together today, we will discuss easy to implement changes that can improve staff safety. We'll also look at industry recommended best practices to reevaluate products and processes across the acute care setting. We're going to focus on just 4 recommendations to improve safety in your facility. Number 1, understanding isolation gowns and changes you can make so that bad habits don't become dangerous behavior. Number 2, surgical gown selection and how to pick the right gown for each procedure. Number 3, a better way to dispose of potentially infectious fluid waste. And then lastly, we'll talk about going latex-free in the OR. So, are you ready, Lesley? Let's dive in.
Well, I think the message that we want to send today overall to healthcare leaders
is that you need to look out for the safety of our frontline staff. I think that's the take-home message. And as we look out for the safety of our frontline staff, it's going to allow them to just focus on the patient. So we want all of the safety behaviors to become second nature, so that, you know, our main focus every day is on the patient. Next slide. So you really, you know, good habits really afford us protection. And if we do the things the same way over and over, it becomes second nature. This is important with PPE because using PPE is each time the same way is going to set us up for success. So when you only wear a certain PPE piece and don't have everything, your gown, gloves, and your eye protection every time, then you're going to have a problem sooner or later because the situation could change. So you really need to enforce, as a leader, the proper use of PPE and using it to the same extent each time that your staff have patient interaction. The situation is not to be judged and met with different levels of PPE. There should be one level of expectation for PPE every time. So, and as the slide says, you go in thinking that it's a low-risk situation and thinking maybe you don't need every single piece, a gown, gloves, and eye protection. But that's where we're wrong, and those are the situations that become dangerous without a moment's notice. Next slide. Thank you. Okay, so one of the most common things is the unfastened gowns that you just slip on the gown and go into the patient's room because you're in a hurry and you just have to do one thing. So I don't know why we don't fasten the neck on our isolation gowns, but we don't, and we're in a hurry. So it just takes a minute, but it's really inconvenient. So right there you have a risk of something getting on you or cross-contamination. So the point of donning and doffing our PPE, this is where the risk really lies. So we need to make sure that we put it on correctly and we take it off correctly so that, you know, we don't cross-contaminate. It sounds like a really small thing, but it can really lead to a huge problem if it's not done right. Next slide. So the simulation study that on this slide was done at the University of Pittsburgh Medical Center. And I like this number because it demonstrates to us that we need to don our PPE and make sure that we're wearing it properly. It just, you know, we need to police each other. And so if you see someone that is not wearing their PPE correctly, you need to point it out to them because they may not be able to see that. So one of the, if you notice on the slide also that the staff's concern in the survey of the readers is, you know, they feel like this 43% felt that PPE was even more important than hand hygiene, which I thought was pretty interesting. Next slide. Okay, and now this is a really avoidable path. So if you read through this, I'll just give you the highlights where the nurse grabs that gown and dons it and goes into the room, but never really fastens it. The patient cross-contaminates her, and then now she has an exposure. Just by donning her gown properly, so much of this could have been avoided. So that's why we're talking about choosing a gown that you can go over to the next slide. So if you choose a gown that slips over the head and dons quickly, it leaves little room for donning errors and decreases the risk of exposure. The overhead gown really removes the risk entirely, and because there's only one way to wear it. But once you have it on, you're protected. There's no issues about tying the neckties or having it fall forward for cross-contamination. I think it's really clever, and it makes it so easy for the clinician not to have to worry about tying the tab or finding someone to do that for you. Next slide. So many of the leading hospitals have transitioned over to the over-the-head full back gown, and that is a level 2 isolation gown, and have had great success with that. It increased the compliance, and it simplified the PPE protocol, and it reduced auditing and retraining time. And so every time you don't have to worry about who's around watching you with your PPE. It goes on one way, and it's very simple. Next slide. So now we're going to talk about surgical gowns. And surgical gowns are rated by their protection by AAMI. And I just want to cover, for those of you who may or may not be familiar with AAMI, actually the acronym stands for Advancing Safety and Medical Technology. And this is a non-profit organization. It was founded in 1967, and it's an alliance of approximately 7,000 healthcare technologies. And they're united by one key mission: to support the healthcare community in development, management, and use of safe and effective medical technologies. So that's who they are. And they help us with the standards, especially as we're going to talk about today, the surgical gown. So there's 4 different designs of surgical gowns, and there's four different levels. So you need to decide, especially we're talking specifically to, next slide. So there's 4 different types of, or 4 levels of AAMI as it relates to the type of material that the gown is constructed in. Level 1 being a low risk gown that you might not be a heavy case like a biopsy or something. And so they're rated through 1 through 4. The gowns are deemed through level of protection through various rigorous lab testing, and that's how they go ahead and rate the gown. So just in a survey of the OR staff, as you heard me describe what AAMI is, 45% aren't really familiar with that, and 33% agree that all surgical gowns offer the same level of protection, which they don't, and 46% agree that the same level of protection, but they're just different sizes. So you can see that this is one part where we really haven't done such a great job in education. Next slide. So this is interesting because the lack of understanding could lead to mistakes. So the AAMI levels were actually created to protect us so that we could decide which gown to wear. But the problem is that, a lot of us didn't know about the AAMI levels and, what they all meant. So I'll give you an example of a personal experience that I had. A major level 1 trauma center was using cloth gowns, and only the cardiac surgery had the level 4 gowns. So no one understood the protection levels. So as it was, everyone was wearing a level 2 gown in surgery. And as soon as we, figured that out, we educated the surgeons and the staff, and so then they can make their choices if they had to go to the shelf and pull a gown. But what was really great is we also had a pack program where we could decide for them and take the guesswork out. So if they were dressing out of the custom pack, then we made sure that the appropriate protection level was in that pack so that when they did their case, it was something that they didn't really need to worry about. And those are the kind of management tools you can use to make sure that your staff are protected. Next slide. So, there's 3 basic questions that you need to ask yourself before you choose a surgical gown. The main thing is fluid, because the fluid is what would permeate and give you some strike through on your gown. How much fluid are you going to expect to present during the procedure? And how long is the surgical case? Because over time, even, the best gown may not protect you. And really, what is your role in the procedure? Are you the surgeon? Are you the scrub tech off to the side? Or are you just an observer? So really, those are the 3 questions that have an effect on what you would really choose. And we've listed for you that orthopedic procedures, open cardiovascular procedures, any trauma and C-sections, definitely that's a level 4. So that makes it kind of easy to base your choice on right there. Next slide. So the data tells us there's room for improvement in choosing the right surgical gown. So 81% of the total knee packs had level 4 gowns, so not quite perfect, and 88% of C-sections, a little better, but 61% of open-heart adult packs contain level 4 gowns. So my personal recommendation would be for anyone that is, a leader in the operating room, or if you're a staff nurse in the operating room, I would suggest to your leadership that you have someone come in and do a review on your surgical gown for the appropriateness and recommend what really would be appropriate for what, the cases that you're doing, and spread that education. It really goes a long way, and everyone can protect themselves further. Next slide. Okay. So this is where it's good to provide education so that everyone knows how to protect themselves, and they don't assume every time they pick a gown that it doesn't matter, because it really does. And so you just, by educating and providing that for your staff, as well as doing a review of the gowns that they currently use and what you have on the shelf, is really the double-edged two-pronged program to kind of get everybody on board to protect themselves and let them focus on the patient. So, Mary, back to you.
Next slide. All right, thank you. Let's next look at the third topic on our 4 recommendations today. Let's look at eliminating the spilling and splashing of infectious fluid waste. Next slide. Infection control practitioners and OR directors, we often assume that the facility's waste disposal protocols are consistently being followed. However, we know better. Low personal protective equipment compliance during waste disposal, paired with the potential for airborne contaminants like spills and splashes, can create an immediate but preventable impact to their staff's safety. I know you all aim to be meticulous about transferring waste and disposing of it safely, but even so, minor but important procedural details can sometimes be overlooked. Not only is this risky and costly to your facility, it's inconsistent with accepted best practices for fluid waste disposal. You wouldn't think about running to the corner store for a gallon of milk without your seatbelt, or taking your small child or small grandchild to the park in the car without a seatbelt. Why would you think of not suiting up correctly to get rid of possibly infectious fluid waste? Next slide. But with every single time a healthcare worker pours fluid from an open canister into the drain, they may be exposed to airborne contaminants and possible splashback. Paired with the improper PPE, the worker could be exposed to numerous hazardous pathogens such as Hep B and HIV. And I know all of you out there in the audience that work in the operating room are thinking, I've already solved this problem. I am using a large volume closed system for my fluid waste. But ask yourself, how are we disposing of potentially infectious fluid waste from the anesthesia machine, from the ICU, from the GI or endo lab, or even the emergency room? Virtually every other patient care area will generate some kind of fluid waste. How do we dispose of that? And how are we putting our workers at risk? Next slide. Despite annual training, research suggests that as many as 17% of waste disposal handlers do not follow proper disposal protocols, and up to 24% do not wear a gown or facial protection. This includes not only clinical staff, but also those in environmental services. Unfortunately, you don't always know if a patient is infected with a bloodborne pathogen. And since not all patients have been diagnosed, waste handlers should assume that every contact with blood
and body fluids could be an infectious exposure. Next slide. Besides just the risk to your fellow team members, there is a risk of violating guidelines, federal regulations, state regulations, and recommended practices. All of these are designed to keep your staff, your patients, and your community safe. Next slide. As we mentioned, research shows us staff is at risk. They're at risk from improper disposal techniques, they're at risk from failure to wear proper protective equipment, and they're at risk from multiple risk points in the process itself. What is the cost of an absent, valued employee due to an exposure, an avoidable exposure? Next slide. Obviously, when workers deal with potentially infectious fluids, reducing their exposure to spills, splashback, and aerosolized contaminants is critical. Healthcare has come a long way in infection prevention, but there's still room for improvement. The good news is, through the institution of safe work practices and engineering controls, workers' exposure can be significantly reduced, and it doesn't have to be painful for the hospital or its staff. Waste management steps like disconnecting suction equipment, carrying a canister full of liquid to a waste site, and the actual disposal can all be potential hazard points. But a canister of fluid waste that has been solidified helps prevent exposure incidents like spills, splashbacks, or the inhalation of airborne contaminants. Next slide. Just because something isn't standard practice today doesn't mean it shouldn't be. Think back, and some of you can, some of you won't be able to do this. I'm dating myself here. Cars originally were built without seatbelts. American car manufacturers didn't even offer them as an option until the mid-1950s. And then it wasn't even mandatory for passengers to wear them until 1983. It became more necessary when cars became faster. Kind of like a faster-paced clinical world that we live in now, but people still resisted because they added to the purchase price and weren't comfortable for every body type, meaning every person body type, not car body type. Today, we can't even imagine not buckling up. Putting safer fluid waste disposal practices in place is not so different. They've been around for a long time, but not everyone buys into the idea. It can be hard to implement a change when people don't fully realize the benefit, but in the end, it's really worth the effort. Next slide. Now we're going to talk about the last topic in our 4 topics of improving safety in your facility or your department, and we're going to talk about why going latex-free in the OR matters to your staff today and even tomorrow. And I'm sure many of you either believe you are already latex-free, and you may be, or know all about why you should be latex-free. Next slide. Did you know that due to repeat exposure to latex products over time, healthcare workers have an increased chance of developing a latex sensitivity? In fact, up to 17% of healthcare workers are affected by latex sensitivity compared to just 1 to 6% of the general population. When I first saw that statistic, I was really surprised by it. But then I started to think about colleagues that I worked with, people that I see even in my practice today, and how many more people have a sensitivity to natural rubber latex products than did even 15 years ago. Additionally, removing latex from your OR can help you avoid unnecessary and preventable costs. In fact, in a recent study of Alta Bates Hospital, part of the Sutter Health System in the Bay Area, concluded that maintaining latex in the OR can create additional costs and inefficiencies that could total more than 25% of the total annual operating room department operating costs. I thought that was pretty interesting as well.
Next slide. This is especially true as it relates to the best demonstrated practice of using synthetic surgical gloves in the OR. Eliminating latex has been a key focus of U.S. hospitals for the last decade, and now 65%, that's a big number, 65% of all surgical gloves used in the U.S. are non-latex surgical gloves. This evolution occurred in part to remove the increased chance of OR staff developing a latex allergy due to a repeat exposure to latex. Next slide. Not only are our colleagues converting over to latex-free gloves, but synthetic gloves are recommended as a best practice by almost all health safety authorities, including the National Institute of Occupational Health and Safety, the Association of Perioperative Registered Nurses, and the American Academy of Allergy, Asthma, and Immunology. In addition, the state of Hawaii recently passed a law prohibiting the use of latex gloves with limited exceptions by personnel working in healthcare facilities. And despite synthetic surgical gloving being as a recommended clinical best practice, many hospitals still believe that standardizing to synthetic surgical gloves will come at a greater financial cost. Next slide. But healthcare facilities across the U.S. already have protocols in place to actively manage latex and have taken action within their facility to remove almost all of the latex products from the OR and the entire facility. They have taken them out of their custom packs. They usually will have a sign in front of their lobby proudly displaying and announcing that they are a latex-free facility and do not allow any natural rubber latex balloons in their facility, but yet they still have latex surgeon's gloves in their operating room. Leading health safety authorities already recommend synthetic surgical gloves as a best practice for patient and staff safety, and leading research institutions like Johns Hopkins and Cleveland Clinic have eliminated latex from their ORs over a decade ago. A recent study, what's pointed out on this slide is a recent study of 100 physicians, staff, materials managers have stated that 23% know someone who's unable to perform their duties at the hospital because of a reaction to natural rubber latex. 63% believe there has been an increase in reactions over the last 5 years, and a large amount, 96%, believe eliminating latex leads to a safer environment. Now you can move to the next slide. Many hospitals, from your regional competitors down the street to some of the U.S. News and World Report best hospitals honor roll facilities, are already realizing these benefits. Their investment in the standardized, clinically recommended practice of eliminating latex products from the OR not only helped to improve safety and patient care, it's allowed them to avoid unexpected potential costs, to reduce their inventory complexity, and to ease their decision-making. Not to mention that today's synthetic surgical gloves are nearly identical to latex in terms of fit, feel, and performance. And those are the three things that people really want in a surgeon's glove. Is it going to fit my hand? Is it going to feel like my skin? And is it going to perform the way I want to? Synthetic gloves are in the same space as latex gloves. Moving latex-free is now easier than ever. And it can happen at your facility too. Next slide, please. Next slide. There we go. So, and it's hard to think of employee engagement and not think of Southwest Airlines. I don't know if you guys fly very much. I certainly do.
And when I think of Southwest Airlines, their HR team or their people department displays the following mission statement on the wall of their headquarters office. And it says, quote, "Recognizing our people are the competitive advantage. We deliver the resources and services to prepare our people to be winners, to support the growth and profitability of the company while preserving the values and special culture of Southwest Airlines." What if hospitals, and many probably do, but what if all of us started looking at the employee group as our competitive advantage, making decisions to create a safe environment for the employees where they feel valued and cared for would make an impact on employees' engagement that would ultimately transfer to patients. Next slide. Safety is all about making a commitment. Success with implementing best practices, clinical safety initiatives in your department or your hospital is like a desire to be in better shape. And it is the first of the year, so I know we all have that same desire. You can buy the gym membership, you can hire the personal trainer, but at the end of the day, if you don't do the push-ups yourself, you don't go out there and get on that spin bike, you are not going to get fit. Having stated clinical initiatives in place, but not reinforcing them to your staff by choosing products to back up the initiatives and championing supporting educational tools to your staff will not get the job done. Cardinal Health offers the clinical expertise and the experience to help partner on any of these safety improvement initiatives that we talked about today. Both Lesley and I thank you for your attention to this important topic on improving safety at your department or your facility, and we'll be happy to take questions. Thank you.
Thank you. Great.
Thank you, Mary and Lesley, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. Got several good questions coming in right now. The first one we have is, driving change is often expensive as it requires costs to evaluate clinician time to train in addition to the continuous effort to drive adoption. The motto at my hospital is, if it's not broken, don't fix it. How do I get past that attitude? Mary, would you like to take this one?
Absolutely. And that's a really good question. I hear that a lot from a lot of folks. And, to be quite honest, if it isn't broken, why do I want to take the time and energy to do something different? A good example is the change that we were just talking about, the change to standardized products to latex-free. Eliminating latex has been a focus, as we mentioned, in U.S. hospitals for the last decade. But interesting, 43, actually it's less now, 35% of all surgical gloves sold still contain latex. Unfortunately, what some of these decision makers don't realize is that not standardizing to clinically recommended products and protocols can significantly increase their operating costs by greater than 25%. And it doesn't include avoidable risks, which also come with higher costs that may compromise their patient or staff safety, have negative impacts to retaining valued staff. There was a published research article that estimated hospitals with OR rooms that keep latex gloves in their product portfolio are incurring more than $177,000 in incremental costs per room annually, of which most are preventable. Costs stemming from clinician and patient testing, treatment, staff absenteeism, and workers' comp claims. This could translate to hundreds of thousands of unnecessary cost dollars per year, depending on the size of a hospital like yours.
Wow, some great points there. We've got some more questions coming in. We'll go with this one. So what tips or recommendations do you have on how healthcare facilities could better manage PPE/isolation gown compliance with their staff. Lesley, you want to take this one?
Oh, sure. Thank you. So healthcare workers are scientists and problem solvers. And I have to say, I'm always impressed with nurses because they are very creative. And if you don't give them what they need, they'll try to work around it. So it's better for, up front to give them what they need and the know-how and the products to protect them and their patients. So we need a solid foundation. And I think the education piece about the PPE is really what we need to do for our clinicians and our nursing staff to know how to protect themselves. So things that, some hospitals already use a lot of the infographics. That's a great way to have a visual reminder for using proper PPE. And I know that a lot of times it's on the patient's door, and so that you know exactly that it's time to, don everything before you go in. And I think that's arming them with education and reminders really is how you're going to protect them. They can make their own choices.
Thanks for offering that advice. Lesley, why don't you take this next question as well? Why is it important to understand how the level of protection varies between certain gown products?
So there's a lot of different manufacturers that make the gowns and other PPE products in the market, and they're all closely matched. But however, all the products don't offer the same level of protection. And so, as healthcare providers, we need to make sure that these manufacturers are procuring products that will give our staff a broad spectrum of coverage and protection. And so actually understanding what is required in order to be awarded a barrier protection level is key. So the clinician needs to understand what a level 1 gown or a level 2 gown or level 4 means. And so, yes, so then the hospital, we don't know when the last time their product selection was reviewed. There could be an update for a new product available and that offers them better protection. So it's the leadership really of the hospital that needs to drive that to make sure that the right protection is on the shelf.
Thanks for that, Lesley. We've got another question here. Mary, why don't you take this one? We use a closed all-in-one system. Why would I look at solidifiers?
Well, you're right. Some facilities find an all-in-one system to be useful in their high-volume operating rooms. But these systems can be expensive and simply aren't practical for all areas of the hospital where suction is used. Some of the questions you might ask yourself is, would you use a closed system pump for cases where fluid volume is low? Where are the suction canisters used? Meaning places, as we mentioned earlier, like in labor and delivery, the emergency department, and intensive care unit, in patient rooms. All of those areas may collect some infectious fluid waste, and perhaps that all-in-one system wouldn't be practical in that particular area. That's where a solidifier might be best, and that way you're protecting all of your employees, not just some where there's a higher risk. Everyone should be protected.
Great. Thanks for clarifying that. We've got another question here. Latex-free gloves are less comfortable to wear than latex gloves. Surgeons will revolt. How can I get them to change? Mary, would you like to tackle this one?
Yeah, I'll take that one. I'm sure many of the folks that are managers or directors in the operating room or staff are certainly going like, I know that story. But how do I get them to change? And the choices of glove materials have vastly improved over the years. In the past, latex-free or synthetic gloves had not been widely accepted, and people didn't like them because they didn't fit well, they didn't feel well on their hands, they were really stiff and boardy. I think manufacturers now are able to produce gloves with latex-free materials that mimic the fit and feel of latex. Both the acceptability and the performance options, as we talked about earlier, have greatly improved. And as a result of these advances in material technology, physicians, surgeons are much more likely to look at them and say, I can have a thick glove, like for ortho. I can have a thin glove. I can have all the options that I had on the latex side, only it's latex-free. And it feels as good on my hand. It performs as well as the natural rubber latex. So I think they're pleasantly surprised. So it's a little easier than it was, and many of them may not have tried it in quite a few years, and so are surprised by how nice they are.
Thank you, Mary. In our next question here, it's solidifiers have been around for many years. Why are you talking about them now? Mary, you want to take this one as well?
I will. Like you, Cardinal Health cares about the health and well-being of our customers and their patients, and we stay informed about industry topics, trying to bring important conversations to the forefront. Patient and staff safety is a critical issue that is frequently a topic during our advisory board meetings and with our other customers. Raising that standard of fluid waste disposal safety is one small way in which we're responding to the concerns of your peers. So that's why we're bringing it to the forefront. And again, I think that with some of the other advances, we're looking at how do we have that same level of safety for all of our employees, not just those that are using at risk for large volume fluid waste.
Great. Thanks for that answer. And with this next question, Lesley, why don't you take this one? Can you share some of the most common PPE isolation gown mistakes you've seen during your clinical experience?
I think that really the biggest problem that I see, and I mean, it's kind of funny to me because you see it in the hospital, but you also see it on TV as well, if you have a favorite medical show, where people put on their isolation gowns, but they never fasten the top. I've never seen it fastened. You know, it's always illustrated that way to be, you know, actually be like a hospital. But in the real life setting in a hospital, I see the people donning those isolation gowns, and they just don't ever, you know, pull the tab or tie the tab. So that's really what's the main thing I see. And then also, you know, we need to police each other as clinicians, because I see a lot of people that don't wear face masks or eye protection. And I think that oftentimes they forget about the potential splash. So I'd say those are the two biggest things.
Great. Thanks for sharing that. And we've got a bunch of great questions coming in. We're gonna go with this one. I'm not aware of any OSHA, Joint Commission, etc. rules and guidelines that indicate we're not practicing safe fluid disposal. Have the rules changed without our knowing? Mary, you want to take that one?
Thank you, Brian. Yes, I will. The rules can vary depending on your state, your county, or even your city. And on a national level, the rules have not changed from OSHA or the Joint Commission. But what has changed is the conversation hospital administrators are having about the safety of their staff and patients and what can be done to further protect them. So I think that's really the piece that we need to focus on, is what can we do to provide that safer environment for everyone.
Great. Thanks for clarifying that. And our next question here, latex-free gloves cost more. How can converting to LF be a savings? Barry, you want to take this one as well?
Sure. The cost of one latex reaction can be as small as $10,000 for initial treatment for a patient or a staff member. Think about having an employee out on disability from a latex or latex sensitivity or reaction to their hands. That's $800 a day for one employee out on disability. Think about what it would cost to replace an OR nurse who can't come back to work because there's latex in the department or sometimes even in the hospital. There's studies out there that that'll tell us $64,000 to replace a trained operating room nurse. That's a valuable asset to your department. And then think about what happens when the patient comes in and doesn't tell you or doesn't realize that they're latex sensitive till the last minute. You have to tear down that operating room. That's a minimum of $3,000, not to talk about the time that's been wasted and how we've now put back everyone's schedule for the rest of the day. So there's a lot more cost to just converting to latex-free gloves, and in the end, I think it can be a savings.
Some good clarifications there. Mary, why don't you take this next question as well? Not many people have a latex allergy, so risk from using latex gloves is low. Why change?
There are many factors that really determine a latex allergy, and even those who previously haven't shown a sensitivity to latex can develop it. Patients who have had several previous surgeries and those with food allergies to avocados, bananas, kiwi fruit are more likely to be allergic to latex. Healthcare workers are also more likely to be allergic because of their continued exposure to latex on a daily basis. And individuals undergoing surgical interventions during infancy should be handled latex-free from the very beginning of life to prevent the development of a latex allergy. There's months or years of exposure without symptoms may precede the onset of clinical symptoms of a type 1 natural rubber latex allergy. In many cases, symptoms become progressively more severe on repeated exposure to natural rubber latex allergens. So it's important for a sensitized individual to avoid further contact with natural rubber latex proteins. Yet most facilities made a conscious choice to remove other latex items. As we mentioned earlier, exam gloves are all latex-free in facilities, custom procedure tray items. Most hospitals have removed all the natural rubber latex from there. Latex balloons, as I said, most hospitals have something in the gift shop or the main lobby. They've done all of that to reduce that risk of exposure. I think the time has come that we reduce the exposure even more, especially to our staff in the operating room.
Thank you, Mary. It looks like we have time for one more question. Lesley, I'm going to send it your way. What is PPE and why is it important?
So PPE is the clothing and other equipment that we put in place to protect the healthcare clinicians. In any instance where they might have a situation where they could be exposed to harmful pathogens. So we need to create a safe environment for healthcare providers, and having this protective clothing and eyewear, gloves available everywhere that they practice is really the only way that we're going to do it. And prompting them to, wear their PPE, it protects them, and it also protects the next patient that they're going to treat, and it really does protect the community. I mean, you see somebody at work that forgets something, you kind of remind them, hey, you need to protect yourself because you're protecting your family as well for that, those things that you're exposed to. So it's not just important that the clinicians have PPE, but that they also, as we've emphasized throughout the whole presentation, is they really have to know how to wear it and wear it well and properly in order to be protected. I hope that answers that question.
It's a great point to end on. Thank you, Lesley. And that is all the time we have for today. I want to thank our presenters and Cardinal Health for their excellent presentation and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.